Okay. Where is it? Where? Oh, no, thought I saw it. Hmm. 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 Hey everybody. I'm looking for the secret. I'm looking for the secret of what makes a hygienist tick. Because I have no idea. And the only people who know are you. Danielle asked me to make a quick hello, welcome video. So that's what I'm doing. But I first and foremost want to say one thing. And if you leave with nothing else, I hope you leave with this. Hygienists are the most important people in a dental office, period. And the secret that I'm looking for, only you know the secret. And this Hygiene Leadership Committee meeting has been a long time coming. We've been talking about it since I was on the Clinical Leadership Committee years ago, and Danielle has finally made it come true. You need to be the leaders. You need to teach each other, learn from each other, help the system so that we can take care of our patients better and take care of you better. So before we can go forward, though, we have to go backward a little bit. And I want to tell you a little bit about how the profession got where it is. So this is Florence Nightingale. And if you don't know who she is the godmother of nursing. And it used to be, if you talk about nursing, the history of nursing, that nurses changed bedpans and linens, and early on were really just kind of cleaning up after patients and did kind of the not so glamorous work of healthcare. But then what happened is Florence came along, and she identified on her own that if she went around at night and changed the dressings, checked in on the patients, saw how they were doing, and then reported back to the docs, they had better outcomes for the patients, which then led to the establishment of the first nursing schools in England in the late 1800s, which then led to nursing schools all throughout Europe and then in the United States, and elevated nursing. As medical knowledge advanced, the roles of nurses transitioned into more complex patient care and more specialized practice. So why am I talking about nurses? Raise your hand if you know who this person is. This is Irene Newman, the first hygienist. So Irene, when she did hygiene, she was a tooth scraper and a toothbrush teacher. That's all she did. And really, that was pretty minimal even at that. They didn't have a lot of the great instrumentation, knowledge. They didn't know why they were doing it sometimes. But really what she did was she did the basics. Well, the same thing that happened with nursing has happened with hygiene. You are no longer the tooth scrapers and the toothbrush teachers. You do that, but you're also doing screenings, you're doing assessments, you're doing education, documentation, x-rays, sealants and fluoride, the prevention side. You're also working on systemic work in terms of improving access to dental care. You're serving as the first point of contact for patients. Now, you are the star of the show in most of the offices. And then you're guiding patients through whatever dental care journey they're going through. You really are the primary contact for the vast majority of our patients. So just like nursing, hygiene has evolved. And your role is expanding significantly, particularly when it comes to oral systemic connection. Blood pressures, diabetes, oral cancer screenings. These are all things that were never under the purview of hygienists previously, but now become standard fare, particularly with us at First Choice. So let me ask you this. Are dental hygienists healthcare providers? Now, I'm not there, but I'm hoping that there are a lot of heads nodding and maybe a little bit of indignance. But I'll tell you, it used to be that hygienists were just the tooth scrapers and the toothbrush ladies. And that's not the case anymore. Because dentistry does it right. And I really hope that when you talk to your family and friends about dental care, about why you became a hygienist, you talk about what it is that dentistry does right. I come from a family of physicians. I love this conversation because healthcare has lost its way in many ways. Dentistry, we have prevention focus, education focus, early detection of disease and treatment. We talk about the impact of quality of life with sound oral health, and we're able to demonstrate that. We're accessible and visible. And once again, access because of health insurance sometimes is not great. But if you have health insurance, you can get in to see a dentist. And then visible, when we say visible, it's something that is a regular part of everybody's lives. So are dental hygienists healthcare providers? Of course they are. But let me take it a step further. Dental hygienists are the gold standard of healthcare providers. There are no other healthcare providers like you. So you are the face of dentistry. You are the most important people in our offices. You are the gold standard of not just dental care, but healthcare. And I want you to really embrace that. And I do want you to stop and think, why are you here? Why are you a hygienist? What do you want to do being a hygienist? And it can be big, small, anything. And just know that you are appreciated. You are valued. Our hope is that, through this Hygiene Leadership Committee and other ways, that you're going to be able to impact the health of your patients, your quality of life, and how we work as a system. So thank you all for being here. And I want to just close with, a final little quote from Eleanor Roosevelt, who, if you don't know much about her, you should just do a little Wikipedia search or do a little online search. She was a force of nature. She was a president's wife. It was back in the days when women didn't become professionals. Her guiding principle was, you must do the thing you think you cannot do. And we're talking about hygiene, but that goes for anything you do in life. I hope that, within hygiene, you challenge yourselves to do the thing you think you cannot do, but also beyond that. And our hope is to help you thrive as a hygienist and to help you thrive as a human. So enjoy the night, and thank you for being here, and appreciate all of you. And don't forget, Irene is watching.